Good afternoon, everybody, and welcome to this very special event here today. Altogether Fairer 1 year on, and delighted to see so many people who are attending the webinar this afternoon. My name's Louise Gittins. I'm leader of Cheshire West and Chester Council, and I'm going to be chairing the session this afternoon. Before we get going with the main event, as with all of these things, we've got some housekeeping that we need to go through. So we've turned off the facility for cameras and microphones, apart from the people who are presenting, but we do have a chat facility which you can use to ask questions for our Q&A session later. And what we'll try and do is attempt to pick the most popular questions and aim to answer as many of them as we can do. If you're on social media, please engage with the event by using our hashtag, which is hashtag ATF in capitals 1 year on social media. We are going to have a break at 3 o'clock for 5 minutes to allow everyone to have a break from the screen, and the event's been recorded and will be available on the Collaborative's YouTube channel for you to share and watch at a later stage. So I'm absolutely delighted to see so much enthusiasm in Cheshire and Merseyside. So many people from such a wide variety of organisations have joined this event today. And at the last count, we had over 500 people registered, which is absolutely amazing. Today is an opportunity to come together as partners from many different organisations to celebrate this past year working together to tackle health inequalities. We all want people in Cheshire and Merseyside to live healthy and happy lives, but every place has inequalities in health. We want to address the gaps and celebrate the successes so far. The Marmot report rightly highlights the social determinants of health as a key element for long-term population health, and that is our focus through the Altogether Fairer programme. No one organisation has all the answers or resources, and we can only really improve population health by working together and sharing good examples of good practice. Sincere thanks have to go for the support and expertise of the Marmot team, and we'll be hearing from Sir Michael himself today as he reflects on the past 12 months in Cheshire and Merseyside. Our ambition is to see real change for local people as a result of all of our work. Continuing and worsening health and inequalities are not inevitable, and we want to make a difference. As chair of the HCP, the Healthcare Partnership, I'm absolutely committed to this agenda, as are my colleagues on the Partnership Board. In addition to Sir Michael, we'll be hearing from Professor Ian Ashworth, Director of Public Health at Cheshire West and Chester, and the Lead Director of Public Health for Population Health in Cheshire and Merseyside, and Raj Jain, Chair of the NHS Cheshire and Merseyside. They'll be taking us through some of the achievements so far in this programme and how Altogether Fairer has been integrated into Cheshire and Merseyside. I'm also delighted to tell you that we'll have 2 excellent examples of local delivery to share on tackling health inequalities: the Child Poverty Strategy in Sefton and the Fair Employment Charter in both Cheshire and Warrington and Liverpool City region. But first of all, I'd like to introduce my colleague now, Professor Ian Ashworth, who will reflect on the past 12 months, then take a look forward. Thank you, Ian.
Brilliant. Thank you, Chair. Good afternoon, everybody. Ian here. So we've got some slides to go through and some reflections since we met back last May, all 12 months ago, really. And just a massive thank you for everyone on the call today and previous. We've got a massive challenge ahead of us. There's been some really good progress on there, but there's loads and loads more to do, and we can only do that together. So thank you, first of all, for coming today and your support. Loads to cover, and just some short slides from me, really, on where we're coming and where we're going. So if you could go on to the next slide for us, please, Ryan, that'd be great. So we had a national launch. You'll hear from Sir Michael Marmot later, but we had a national launch with our Healthcare Partnership leadership and Integrated Care Board leadership last year. We knew we were doing something different with the approach we took. Cheshire and Merseyside is a massive place. We worked with our 9 local authority areas, the health and wellbeing boards as a system, and we've all come together around the key recommendations from the Altogether Fairer report to take forward. We really want to get to the causes of the causes, and that goes right across the life course and in the places that we all live, work, grow and age in. So really, it was just also just to highlight how important our Altogether Fairer leads are, our local Marmot communities, and how they've been supported to tackle sort of innovation and share best practice. And we'll come on to a couple of examples of that, really. Grateful to the CHAMPS team and Institute for Health Equity for supporting that group and for all of our Altogether Fairer leads locally. So if you go to the next one for me, please. So it's no shying away from how difficult the inequalities are across Cheshire and Merseyside, and that's shown through the report, which we won't revisit now in this presentation. But one thing that we have all in common is about trying to improve health equity across a range of different themes together. Not one action will solve all of that, which comes out really from the report, but it's really important. It's our job to try and make it feel doable and not impossible. And that's the only way we can kind of do that, is together on that journey. And we've all got different priorities and different journeys in our local areas, but the things that we have been able to do together are really making a difference. And you're going to hear some of those things this afternoon from Sefton, the fair employment work and development of our social determinants leadership programme as well. We've also managed to establish how we monitor, how we progress our work on this with our beacon indicator set. There's 22 indicators agreed right across Cheshire and Merseyside based on the evidence, based on the data, and based on the priorities that were worked up with each local area and local place. And we got a new combined intelligence or population health action, or sometimes called CIPHER, where we monitor that indicator set, and we now put that in place since we met last year. So we can go to the next one for me, please. Just a recap of the crucial themes right across the life course. And that sort of will be reflected by what we cover later on this afternoon. We want to be making sure that we give every child the best start in life, and the young people can be able to maximise their capabilities. There's a big push on fair employment and healthy standards of living for all, which we'll be hearing from Rob from Liverpool City Region and Melissa in Cheshire and Warrington, the work going on here. We know how important it is for local solutions and working with our local communities and making our places healthy ones. So that's at the crux of what we hear, and we'll hear some of that from Sefton's work as well. Prevention runs right through that, and the commitment to making sure that we can help get ahead of all that. And specifically, the last 2 recommendations were specific and new for Cheshire and Merseyside, and that involved us tackling racism, discrimination, and all the outcomes that are related to that together, but also joining up our sort of climate change emergencies and environmental sustainability with the community, local authorities and NHS together as well. So they particular themes on that. There were some additional recommendations for the system that we needed to work on as well, which is on the next slide. And all these slides will be available on the CHAMPS website as well to go back through. One of them is making sure that we look at trying to make equitable funding available to tackle those social determinants, health and those causes of the causes. How we strengthen our partnerships and work and leadership around health equity, and the importance of that with the leadership, which the programme later on described by Alan will touch upon. The importance, we've heard some of this through the new healthcare partnership in place, some of those local led solutions and things that have been developed with people with lived experience in our communities about how we can improve the services and support that we offer to meet people's needs. The massive role of business and economic sector in reducing health inequalities. With social value, we need to extend and embed with our Anchor Institute network. So our NHS colleagues are well on with a lot of that, but at the same, and the healthcare partnership is too, but so are many of our other big institutes right across the sub-region. And also making sure that we try and embed our social determinants approach in all health policies with those beacon indicators I've referenced to measure how we get on with that. So what else have we done in the year 1? So that's on the next slide. Thank you. So first of all, we've had the commitment from the new Integrated Care Board, and also the healthcare partnership to embed those recommendations from Altogether Fairer. And we also have, not everyone may be familiar with, but our Beyond group. This is our fantastic children and young people's programme board, involves our Director of Children's Services, led by Alda Hay, and our focusing in very much on the work, it's that best start in life that we're talking about, and also that complete buy-in from all our local authorities and health and wellbeing boards. Something particularly we should be proud about, that we've come together to tackle the same challenges together on that. We've been working with our community sector, our health equalities group, with our NHS trusts about adopting prevention pledges. We are also looking now to establish that and working more within primary care in the future year as well. And a big thing that we'll all be familiar with is the challenge around fuel poverty and cost of living that we've all been having to deal with this year. We came together through the links that we had from Altogether Fairer, bringing in our Northwest colleagues, intelligence, and actually, you know, some really grateful to some of the clinicians at Alder Hay in the production of a range of reports that show what the impact will be on our most vulnerable in society and in our communities. We also were able to do a range of sort of self assessments with nice guidance, and created more intelligence projects to help target and support those households that would be more susceptible to fuel poverty, respiratory illnesses, etc. as well, and being able to support them, linking in with our social prescribers and the local authorities' responses to the cost of living. So it's all been really joined up and learning from each other as well. We've also seen there some of the fantastic responses that I've alluded to, such as Warrington's Poverty Action Group and the Cost of Living Fund that they've been able to establish. Next one. I won't touch too much more on the Fair Employment Charter, but you can see some of the examples in there. We've also included and many are able to put in a range of new strategic frameworks in place. Fantastic work for our local areas and our sports partnerships in a new Altogether Active physical activity strategy. The governance and making sure that we support our local community leads, our Altogether leads, and driving innovation and challenges where we can make improvements. We've been really successful in establishing a new health equity collaborative, one of only 3 integrated care systems nationally, to work with Bernardo's and the Institute for Health Equity for that. And also grateful to Dr. John Griffiths and Greg Irving around developing a new GP-led Deep End initiative that's working with our most deprived communities. If we can move on. Things coming up, which I've alluded to, and we'll touch on later in the presentation as well. But you can see where our sort of priorities are and where our focus needs to be. And the next slide. Again, those social determinants of a health program, the leadership program that I hope many of us on the call will be hoping to get access into and support with. We also need to think about how we keep the momentum going. It's been 12 months, quite amazed that it's been 12 months so quickly, but building on everyone's passion and energy to make a difference, it really, we need to do more of that together and share the good learning that we're doing, but also where we really need to focus in on as well. And that's not understating the challenge that we all will be facing in our local areas. Also really important that we have our adopt our healthcare inequalities approach. And you may have heard that NHS score 20+5, number of key indicators working with our most deprived communities, both in adults, but also children, that we need to reflect and think about when we're talking about the social determinants of health and treating ill health as well. So I think we're just about to wrap up. I think there's, if we can jump onto the next slide for us. So year 2, we'll touch on some of the things you mentioned there, but we have to embed that leadership development, working with yourselves. We need to look at the resource provision available to make these changes and achieve some of those recommendations. Now that we've been able to baseline some of the indicators and the data that we've been gathering, we need to evaluate that and support our local areas and how to measure what is making a difference and keep a spotlight on improving. And also look to support any innovation across the 9 areas and share that best practice together with it, working really closely with the new healthcare partnership and the integrated care boards as well, and as well as our 9 health and wellbeing boards. And I think that is it from me.
Thank you very much, Ian. It was great to hear about all that progress, and I think we will dig deeper into some of that during the rest of the afternoon. So I'm delighted to hand over now to Raj Jain, who is Chair of NHS Cheshire Merseyside and partner in crime on the healthcare partnership with me. So delighted to have you here today, Raj, and over to you.
Thanks, Louisa, and I'm delighted to be here today. And my prime reason for being here today is to state unequivocally my board and my own support for the agenda that we're talking about here today about social determinants. And I've been asked to speak about integrated working and social determinants, and you'll see some bullet points up there on the slide, and hopefully I'll make them come to life for you. I'm not about to tell you about a technical approach to this. I'm not about to tell you about the governance approach to it. It's really, what do I think about the issues and the challenges that we face, and my own diagnosis based on the evidence out there of where we need to focus in on and how we need to change, primarily around the culture of our organisations. So firstly, I'm disappointed I haven't got a smart background like everybody else seems to have. Apologies for that. I was thinking about what I'm going to say in these 10 minutes, and I couldn't help but not talk about this first thing about that I've called challenging times with monumental long problems. And it's primarily because of this reason. Well, we can see in the last couple of years the exacerbation of those, or how social determinants have exacerbated the poor health of the populations that we serve. We know now that life expectancy in our area, in the country that we are, is at best flatlined, and in lots of our wards, local authority wards, have actually reduced. And whilst there's still work going on about why that is the case, there's no doubt that some of it is obviously to do with COVID, but some of it is to do with deprivation and the life chances that people are having. And if we don't think through and acknowledge the really significant problems that we've got at the moment, we're not going to get the right frame of reference for trying to take forward our ambitions around working on the social determinants, changing our organisations, and making progress. So what do I mean by monumental long problems? I'm pretty sure they're going to be obvious to you. It's climate change, obviously. It's about the level of austerity and deprivation that this country suffered for a long time. It's about how state, public sector and citizens are now it feels as though quite a state of flux where we haven't got the certainties of the past. Some of that's good, but about roles and responsibilities in society and how that's fluxing. It's about technology changes, and currently it's about the cost of living crisis. I call them long problems, and they are monumental because they are both going to be assistant with us for a long, long time, and are hugely influential on the populations that we seek to support and serve. So where I then go to is, I then started asking myself this question about where's our humanity, and what do I mean by that? I mean this, which is being a public servant for over 30 years, working in many organisations where I've been enormously proud of the support, the care that we've been able to give. It began to dawn on me that we hadn't changed our attitude or our culture to how we were engaging with people in the public. We use terms like service user, we use terms like patients. And while things like service users and patients especially seem to have a bit of a warmness around them, they're a bit cozy, aren't they, in some ways? They seem very people orientated. Using terms like that, I think, help lead to organisations like hospitals or GP practices, so on and so forth, thinking about the people that they're serving in a manner where they want to standardise those individuals that are presenting to their service. They want to be able to wrap a description around them that puts them into relatively neat boxes, often complicated, but relatively neat boxes. And if I was to use extreme language, it's almost as though we want the people that we serve to be widgets in our machine so that we can bring them in one end and process them and get them out the other. So what am I going on? What am I babbling about? I think as we currently look at how many of our organisations are seeking to improve outcomes for the populations that they're serving, their approach generally is to look at current service provision and say, we're going to do that even better. We're going to make it more effective, and actually we want more of that service provision, and that will lead to better population health outcomes. Not all, there's really good examples where people are thinking differently, but the majority of viewpoints are that. The majority of actions are about taking today's services and trying to make them more efficient and more effective. And that's what I mean by doing the wrong things really well. Those services, as much as they are needed, as when we're, for example, really unwell, really important for us to pay attention to them, but they won't change the curve on population health. It is the social determinants of somebody's life that really changes the curve on population health, reaching to the converted here. But the services and the organisations that are currently working in the health and care sector, not all of them, but the majority of them, especially the majority of NHS organisations, are very focused on services to get those widgets through and getting those services to be more efficient so that we can process more of those widgets. And quite frankly, that will just give us what we've currently got, which is increasing poor health, lack of well-being, lack of prosperity in the people that we're serving. So what myself and many colleagues on this call and in this conference are trying to do, we're trying to change the narrative that organisations in the public sector are using. We're trying to shift that from that parental child viewpoint to really looking at the people we serve as people. Hence the bullet point, people, people, people. I find myself still, despite me being convinced that we shouldn't be using terminology like patients and service users when we're talking about improvement. We should be talking about people. I still find myself slipping into that old language. So I'm having to think differently. Right? Get your words right, because what you say matters to you as an individual, as myself, as well as matters to other people. And by concentrating on people, I think we'll get to the root causes of helping our people to deal with the symptoms of what those root causes are. And as we know, 8 out or 9 out of 10 of those root causes don't lie in the biological function of the human being, of the person that we're trying to support or care for. They lie in their environment, they lie in their life chances, they lie in how they were supported as children, they lie in their job opportunities. But there is a growing recognition in lots of organisations in the public sector that it is right and proper and it's more effective to look at things that we traditionally haven't looked at. There's a growing understanding that we've got a long road to go, and there's a growing understanding that we've got a long learning curve to get things right, to enable us to optimise. Quite frankly, the significant resources that we have in my organisation, that's £6 billion a year, and making sure it's orientated as much as it can be on root causes, i.e. the social determinants. And that's where integration comes in. Just banging organisations together to say, right local authorities and the NHS and voluntary sector and faith sectors, you've got to work together. That doesn't work. What we all need is a really clear common purpose that's described in terms where we understand the connectivity. Sorry, we understand how we need to connect to ensure we continue to focus at all times on the needs of people, as human beings, and working together to help them support them to tackle some of those deep-rooted causes that lead to poor population health. So apologies if that seemed a bit of a ramble. Apologies if you were looking for me to explain how the ICB works and how the HCP works. But what I'm hoping you've taken from me today is an understanding of how we think we need to develop and change our organisations in the public sector. There's I don't know if people have come across somebody called Donna Hall, Professor Donna Hall, who was responsible for leading the Wigan deal. She coined a phrase just a year or so ago about establishing a rebels alliance, i.e. Star Wars type of stuff, to enable organisations such as the public sector to change. And that's what it feels like at this moment. We need as many people as possible to be articulating the argument for change, to be lobbying for that change, and to be that change in themselves. I'm really looking forward to hearing the rest of the conference, and thank you for giving me some time to talk here today. Thanks, Louise.
Thank you, Raj. That was brilliant. And I will be one of those rebels. I'll join that alliance and help everyone on their quest to changing hearts and minds and how we need to go in a different direction. Fabulous. Thank you. So now we're going to have two excellent examples of where things are being put into action to move towards our altogether fairer aims. And we're going to hear about the child poverty strategy first in Sefton. And we're delighted to be joined by Anna Nygaard, who's Head of Inequalities and Strategic Partnerships, and Margaret Jones, who's Director of Public Health. So Anna and Margaret, over to you.
Thank you, Louise. Anna and I are going to do a double act. We're going to reflect and share on the experiences of working on the Sefton Child Poverty Strategy. I need to stress that this has been a collaboration across the whole of the Council, but really importantly, it's been about working with our colleagues in the community and voluntary and faith sector. I need to thank Angela White in particular, who chairs our partnership group, but also partners in the NHS, in education and in housing provision. What we're going to try and do is tell you a little bit about what triggered the development of the strategy, what and who has inspired us, and then what we're actually doing across Sefton and how we plan to take things forward. So next slide, please. Okay, so I'm not sure, has that gone to the right slide? Can we just go back one, sorry? Oh, I think our slides have got mixed up a little bit here. Doesn't matter. This is actually our time frame. If you go back to next, that's it. Thank you. This is our time frame. It's not surprising that, you know, poverty is a real issue, not just for Sefton, but across Cheshire and Mersey. And what we have in Sefton is we have a long established welfare reform and anti-poverty group. And that's a members-led group that directs the strategy and policy, but we also have a wider partnership group, as I said, chaired by our CVS lead, but that has a real wide range of partners, housing associations, fire and rescue, DWP, you name it, they're on that partnership together. And we work to try and mitigate the real negative impacts of child poverty. Council declared a poverty emergency in 2021, and then we had a public health deep dive that looked particularly at child poverty, and that triggered a request from our elected members for public health to go away and work with our partners and look at how we could start to develop a specific strategy around children. So we did that. We had a stakeholder event, and then we launched the strategy last December. But it's obviously important to stress that that wasn't in isolation. We're all aware of the cost of living crisis and rising fuel costs and inflation. But also, I think what's been really helpful for us is being able to dovetail our work really neatly into the altogether fairer approach of reducing health inequalities. So we're really grateful for the opportunities for working in partnership with our health colleagues and for the Healthcare Partnership for commissioning the review that was taken just over a year ago. And we've also, through this work, been able to work and get support and encouragement with members of Sir Michael's team. So I'd have to say particularly Tammy Boyce, who's been really supportive in the Sefton work. So next slide, please. And that's the one that threw me, because I thought that was going to come up second. But I won't dwell on this too much, because we're all really aware of the shocking statistics around child poverty and the really unacceptable statistics around child poverty. But this just gives you some of the not highlights, lowlights really, but some of the key points from Sefton. 1 in 6 of our under 16s are living in relative poverty, and we've seen a significant rise over the past 5 years. And again, like many of yourselves and other parts of Cheshire and Mersey, if we look at the social determinants, if we look at those children who are living in the most deprived areas, we know they've got poorer outcomes when we're looking at things like childhood obesity, teenage pregnancy, educational attainment. And the one I draw your attention to is the bottom right-hand corner. The social mobility. It's really stark in Sefton, and I know I'm talking to colleagues who will probably be well aware of Sefton geography, and you can see that's a real huge gap across our borough. Next slide, please. So obviously that's prompted us to work on a child poverty strategy, and I have to admit that when we were looking at what was going elsewhere, we looked around for examples of strategies across the whole of the UK, and the ones that I think impressed us most was work that was being done in Scotland, and we really like the sort of simple breakdown and focusing on different themes, and these were themes that really resonated with the discussions that we had at our stakeholder event back in 2021, and also the discussions that we were having in our partnership groups. So what we did was when we had our launch of our conference, and when people came together, we asked them to sort of think of things through a child poverty lens. We don't have additional funds to do this work. This is about how do we sort of galvanise the work that we're all doing already into this child poverty theme. So we're asking people to look at what can we do to reduce the time that people spend living in poverty now, because we know that's going to have an impact on future health. How do we minimise the negative effects of poverty on children's education? Because again, that was a theme that really came out in local discussions. And how do we prevent future poverty? So our priorities are pockets, prospects and places. Now, if we're going to move on to the next slide, and Anna's going to take you through the last few slides on the specific priorities and how we work across health, education, planning and business, etc. How we work across those wide areas to align against these priorities.
Hello. Okay, so what we'll do, in terms of what we're doing in Sefton, if we look at pockets first, so this is about what we're doing here is many of you will have similar interventions, but just some of the things that we are going on to maximise incomes include our emergency assistance scheme, the council tax support affordable warmth team, our summer food programmes. We have support for school uniforms, PE kits, also things like prom dresses. We also have the Living Well Sefton service. Now, this is our integrated health improvement service. And as well as supporting people to make positive changes for their diet, through exercise, smoking, stop smoking, etc., we also have our CAB offer. So through our Citizens Advice Bureau, we also have support there through Living Well Mentors. So over the last year or so, we've added a MEC module to the cost of living, stressing all of our interventions need to acknowledge the stresses families are facing in relation to finance. So the Caring Business Charter also aims to help children who have experienced care into work, apprenticeships locally we have running, and the council can also match people with employers who will nurture them and support them as they go on to employment as well. So next slide, please. We have a look at prospects. So again, I mentioned it on the last slide, the Caring Business Charter and helping parents into work also contributes to improving life chances. And that runs alongside our recently launched education strategy, the early help strategy. And we are also about to roll out the Cradle to Career programme, which many of you will know has been successful in Wirral. So if we move on to the next slide, to touch on place. Now, the last 10 years have been really tough on many of Sefton's communities. The economic hardships are really obvious when you walk around some of our townships. And this slide actually shows an artist's impression of the council's ambition to regenerate the Strand area of Bootle. So the work here started way before we put the child poverty strategy together, but the Director of Place has been very supportive, working with us, making sure we can include, expand opportunities that developments like this will have to promote poverty-free communities. In February 23, the council was also awarded 20 million from the Levelling Up Fund and another 2 million from LCR, and this will help start the first phase of this redevelopment. And in terms of the development, what we're looking at is housing, retail, leisure spaces, greening the environment, developing education and technology hubs, and working with the NHS and other partner hubs. But we know we need to make sure that there are employment opportunities for local families, that the space is welcoming to all local people, that it's not deemed just a visitor attraction. We know that the shops and transport links, for example, should be responsive to need. We should have affordable support and should all be health promoting as well. We know as well that transport will get parents and children to jobs and to education, and that the green spaces are healthy spaces. We are mindful we're right next to the large port of Liverpool. So if we move on to the next slide. This is really about our ambitions here. It's about developing a strong coalition for change and ability to share best practice. And that is with conferences. We have a conference due on the 29th of June, where we had 100 people on our last conference, again, to talk about this. Cross-fertilisation with other strategies, for example, our obesity strategy links into this. And we also work closely, as Margaret said, with ICS and the partnerships. And that also includes promotion of our anchor institution role and other trailblazers, for example, the work with that we're also progressing with Alder Hey. So this has been about sharing ideas, very much a collective approach, boosted by the creation of the economy cell, and also working with our regional and national colleagues through OHID and Food Active. So if you move on to the last slide. Thank you. This is really hopefully giving you a flavour of what we have actually started in Sefton, and Public Health's role within that to coordinate and encourage partners to come together around this agenda. We're not naive. We know that decisive actions need to be taken at a national level. But the key is that local collaboration And even small actions, which we've indicated in how we develop our services in our offer and delivery, can actually make a huge benefit. So the focus for us moving forward is about maximising incomes, improving prospects for children and families, creating an environment that supports the infrastructure in a health promoting space, which we're confident that at least we can start to make things better for our families in Sefton. Thank you.
Thank you both. That was really interesting and good to see all that regeneration and how it's contributing towards improving outcomes for our residents. Wonderful. Now we're handing over to Rob Tabb, who's Senior Policy Lead for Liverpool City Region, and Melissa Krellin, who is Strategy and Public Affairs Director for Cheshire and Warrington. And they're going to talk about fair employment and why having a fair employment charter is so important for what we're trying to achieve. So Rob and Melissa, over to you.
Thanks, for getting. Thank you for the opportunity to share what we've been doing in Liverpool City Region on fair employment over the last few years. So just very quickly, I'll try and do this in 4 minutes. We've been on the journey for some time. We recognise that good quality is important. Employment is important more generally, but it has a strong positive impact on health inequalities as well, and can help people to move out of poverty, and we know the benefits that brings for them in that respect. Within Liverpool City Region, we've got quite a high proportion of people who are paid below real living wage. And certainly getting towards 1 in 4. So we know that we need to do more around this. Metro Mayor had this in both of his manifestos that he was elected upon. So we've been working to build that coalition to say, how do we get, how do we define what fair employment looks like? How do we build that sense of what we can agree on? So over a 3-year period, we consulted on this extensively. We would have done it quicker, but something called COVID got in the way. I don't understand what happened there. And what we've ended up with is a charter across a number of areas there, healthy, just, fair, and inclusive, and across 3 levels as well: aspiring, accredited, and ambassador. And across those 3, aspiring is a commitment. We're prepared to work towards that, and the employer might say. Accredited is where we would say this organisation is a fair employer, and ambassador is really exceptional, high level practice that we'd want to call out as part of that. And there are a number of elements within there, and we also took the opportunity of learning some of the lessons from COVID to evolve the charter. So we talked very strongly about mental health support as part of that, some of those issues, but also the importance of home working as part of this. Where are we at the moment? At the point of publication, we've got 77 approved employers that we've taken through the initial aspiring level. We're planning to open up to applications for accredited later on this year. I think there's 2 things, having reviewed all of these applications that have come through so far, that's been really heartening. One is the really excellent practice that's going on in so many employers that they think, they think that's not really very much, but actually when you look at it, that's really, really good stuff. So we want to call out and highlight wherever that is the case. And then employers who are, as a result of their engagement with us, are now changing what they do. There's 2 employers who previously weren't paying fair real living wage, who are now either paying real living wage or have committed to pay real living wage. And I think there's another employer that, as a result of the work that we've done with them, has opened up their doors to trade unions to engage with them. So I think we are starting to see some of those changes coming forward. The more that we can do around some of this, clearly the better, and we need to get more people paid real living wage, so they're paid a good wage, so they can come out of poverty, and help employers to do their best to be able to do that, recognising the significant challenges that they've got on this. Thanks, Councillor Gittins.
Thank you, Rob, and hopefully we've got Melissa somewhere who's going to talk to us about Cheshire and Warrington. Thanks, Melissa.
Hi there, hi everyone. I'm Melissa Krellin from Cheshire and Warrington Local Enterprise Partnership. It's really great to be here. I've been coordinating the efforts in the sub-region about establishing a fair employment charter for Cheshire and Warrington on behalf of our Leaders Board. We started that work sort of in the late summer, autumn last year. And our Leaders Board vision is about developing a sustainable, inclusive, healthy and growing economy. And that's happened post-COVID. It's been a change in direction, wanting to address inequalities. Our area's population is nearly 950,000. We have over 500,000 jobs and 43,000 businesses. So we do have a real opportunity to make a real difference to the social determinants of health, and using tools such as a fair employment charter. So our Leaders Board and our recent Sustainable and Inclusive Growth Commission, which was a public, private, community and voluntary sector commission, both agreed and recognised the importance of a fair employment charter, seeing the good practice that's happening elsewhere and wanting to explore it in our area. So it was agreed that can we move to the next slide, please? That we would have a charter that would be open, like the others, to public, private, community and voluntary sectors. And they would support all, regardless of size, sector or geography, to improve their employment standards, would celebrate good practice so we could make early progress, and it would be free to enter. The Altogether Fairer strategy, of course, is playing a vital role in outlining the evidence for a charter and the positive impact that it can have. It's also about supporting organisations to go on a journey towards a more inclusive culture and towards understanding where and how they can make a difference. And that will also provide benefits to businesses and organisations. Be really clear that we want to get that message across, that it's not just about individuals and employees, but it also helps the organisations that are signing up. So we've done some initial consultation and we are now in e-consultation exercise with events in May and June and an online survey, and because the Leaders Board agreed in March, so we held a launch event with some really good examples of good practice that is happening in our area, and that's all available on our website. So we are now doing that consultation and pulling together then the analysis for the Leaders Board to look at what the next steps would be for implementation. Next slide, please. The rationale, I won't go into too much detail here, but it's we have a very successful and diverse economy in Cheshire and Warrington, but there are real pockets of deprivation, including health inequalities. The analysis shows that we have 47 neighbourhoods in the 10% most deprived for health outcomes. Fair work isn't accessible for everyone. We've still got too many jobs paid lower than the real living wage. As Rob said, we've got about 19%, and that's causing in-work poverty, where people who are in work, but they can work full-time and actually still be in poverty. And then jobs are not accessible to people that need them, that have barriers, such as young people, people with disabilities, impairments and special educational needs, people over 50. And then there's too many people with poor mental and physical health, which then affects their ability to get a job and to stay in work without reasonable adjustments. And a lack of flexibility in work can lead to a lack of diversity of employees and limit recruitment options for companies. So I mentioned the benefits. The fair employment practices actually make a business more attractive to all stakeholders, such as suppliers, customers, employees and investors. And that actually makes a lot of sense, because at the moment businesses are struggling to recruit. So if they can recruit from a wider pool of potential employees, they just need to be a bit more flexible about how they go about that. And you also find that independent research shows the most diverse companies are the most profitable. So there's loads of good messages that we are going to use to get out there. So the next slide, please. So this is our draft charter. We have looked at charters in other places, Liverpool and Manchester, And we try to not diverge too much from those because we recognise that companies will operate across borders. But we have given it a Cheshire and Warrington flavour, and this is what we're currently consulting on. We're looking at what options about tiers of membership, whether we do a supporter like Greater Manchester, an aspiring entry level like Liverpool, a full accredited member like they both have, and ideally, ultimately, an ambassador. So we are looking at fair pay and secure employment as one of the 5 categories, about the real living wage, guaranteed hours, ending unfair practices like 0-hour contracts where it's not requested by potential employees, and safe places of work. Accessible employment is about the inclusion and diversity being mainstreamed into recruitment and into the organisational strategy, making those reasonable adjustments for the underrepresented groups, including those with health issues. And flexible working can really help with that. And we have a lot of schemes like supported internships and apprenticeships, which we like to see taken up much more. Then the workforce wellbeing. Organisations need to understand the drivers of good mental and physical health, and about then use that to provide a positive working environment. Things like healthy food, promotion of active travel, physical activity, mental health first aiders, and so on. Employee development and fulfilment, again, mainstreaming inclusion and diversity, having a good talent pipeline from a diverse range of thinking and backgrounds. And a focus on staff also supporting good causes, because that's also good for mental health. Engagement and voice is about staff being able to influence the direction of the organisation, being consulted on key changes, and about fair access to the representation of, and about to trades unions. Next slide, please. So our consultation is running at the moment. I'd encourage anybody with a view to get involved. We have got workshops in Cheshire West, Cheshire East and Warrington, and we may be putting on additional sessions as required. We are really interested in whether the charter is of interest, what problems there might be, any details that need amending. And from our initial conversations, there is a lot of support for this. There's enthusiasm for how it can support businesses and organisations to help them change their culture. So I think the focus is on the impact, and we're really excited to see what impact it could have and how it could support our ambitions to improve inclusion and diversity. Thanks very much.
Thank you very much, Melissa, and I'm looking forward to our employment charter getting up and running in the summer. Really excited about that. So the next section this afternoon, we're going to hear from Alan Higgins, who is the strategic lead of the Altogether Fairer programme, and he's going to introduce our new development programme. So Alan, over to you.
Thanks very much, Louise. Good afternoon, everybody. So Altogether Inspired is a programme that we're initiating this year. It'll be coming up in the next few months, and it's something that everybody can get engaged with. At the end of this short presentation, there will be a link for you to put your ideas forward today about what you would want to see us getting engaged in, what you would like to get engaged in as well. And looking at what's coming up in the chat, it's not going to be difficult, I think, for people to put those ideas forward. So I would encourage you to do that when we're having a break and then throughout the afternoon as well. Can I on to the next slide, please? So what is the new programme? It's a way of providing staff, activists, leaders, people interested in health equity, and also the ones that aren't interested, but they should be, with those connections, but also to support, which can also be through getting those connections. It's hopefully somewhere where people can post about what it is that they're doing that's going well. It could also be for people to share things that aren't happening, that they've got challenges that they can't overcome, and that they can ask for ideas about how to overcome them. And altogether, that they can get inspiration from each other. So this is going to be a way of engaging people across Cheshire and Merseyside, not just the people who are in leadership roles, but actually we're trying to engage with everybody, with people in communities, voluntary sector roles as well. And going on to the next slide, there's three main ways we're doing this. One of them will be that we will have master classes, which are targeted at leadership across the integrated care system. I'll say a bit more about that in a moment. We will also be looking to fund places at the Institute of Health Equity Summer School, which is in July of this year. And I'll say a bit more about that in a moment as well. And then last of all, I'll just come back to that online platform, which is where we want to engage with people across Cheshire and Merseyside and take those ideas about how to get that inspiration going. So next slide, please. So the masterclasses, the objectives are about accelerating progress on health inequalities, increasing understanding, particularly amongst our leaders, support system leaders to apply this understanding to the role and take full advantage to act. And that last objective there, gain an appreciation of the issues that arise when social determinants of health are being considered within an ICS, within an integrated care system. Because we're recognizing that people kind of know what to do, but it's difficult sometimes to put it into practice. So what we want to get from these masterclasses is also some sharing of, well, how do you get around these things? How do you prioritize doing work on social determinants of health when perhaps there's urgent issues that are around to do with patient services? But we want to get that understanding and then people move on from there and actually put the action in place. Next slide. There will be 4 of these masterclasses coming up later this calendar year. There will be for place directors, but also directors of finance, directors of economic growth, primary care services, borough politicians as well. So quite a wide group of leaders. We should have in there as well community voluntary sector leaders as well. So that's the masterclasses. That's one element of this Altogether Inspired program. Next slide, please. We will also, as I said, be funding 9 places, 1 for each of the 9 boroughs in Cheshire and Merseyside, on the University College London Summer School on Social Determinants of Health, running in the first week of July. Sir Michael Marmot will be engaged in the programme, opening and closing and throughout. And it's somewhere where what we want to do is enable 9 people to come from Cheshire and Merseyside, go to the school, and bring back the additional learning and the inspiration from that work into their individual boroughs. It then means we've got 9 people who will have that additional information back in the Cheshire and Merseyside, and hopefully working together and then taking that knowledge and experience out to wider groups within Cheshire and Merseyside. That's coming up in July. Next slide. So the one that we're particularly excited about, this online social determinants hub for Cheshire and Merseyside. One of the things we might ask you for is, well, what might be a better name for it? Because that doesn't quite get across the kind of energy that we want to have through this hub. But it will be a resource for the latest research on social determinants of health, with a twist in it to point out the relevance to Cheshire and Merseyside. So while the research might be national or international, we want to make sure that we're making it relevant to Cheshire and Merseyside. Secondly, it'll be a platform for people living and working in Cheshire and Merseyside to post their work and then invite other people to do the same. It's a forum through which people can publicise projects. They can post about some event they're having coming up in a month's time or whenever it is, and talk about those projects, those programmes on social determinants of health. And it will be open for everyone. We want to make sure that people can engage in this, not just from those people in statutory sector and leadership roles, but from the community and voluntary sector. And that's where we're going to invite you to help us design this. So I've gone on to think, what is the final slide here? So what else would you like to see from the Altogether Inspired programme? And you can see on that, there's www.menti.com. If you can go on to that while we have a break from screen, and then but later today as well, we can keep gathering ideas. If you go on to that and then use that code, 5278-8214, and that will be posted in the chat as well, then tell us your ideas for what you would want to see on that platform that would inspire you and that you want to inspire other people with as well. So I think that's it, Louise. Invitation to people to tell us what they want to see on this, and all together we will all be inspired. Thank you.
Okay, everybody, I hope you've had a good break, a chance to have a bit of a stretch and get yourself a cup of tea. I'm absolutely delighted to have Sir Michael Marmot here this afternoon to talk and to give us our keynote address for this afternoon. I don't need to introduce him. I think everybody on here is well aware of Sir Michael and all the work that he's done, and I just want to say another big thank you for the support that you're giving us in Cheshire and Merseyside. So Sir Michael, I will hand over to you now. Thank you. You are on mute.
Okay.
There we go.
Can you see my slides?
Yes, perfect.
Good. I have to confess to being an oddball. When in Cheshire and Merseyside, the problems of poverty, ill health are discussed, I get excited, not depressed. And I'm excited because of the absolute commitment that's been on display in Cheshire and Merseyside for the whole of this 1 year on, but very much in evidence this afternoon. Commitment is not everything, I'm aware, but it is a great deal. And without this level of commitment, we wouldn't be getting anywhere. What you've heard this afternoon, which I find very exciting, the Fair Employment Charters. One of the issues, and I'll talk about this at the end of my presentation, in our work with Legal & General, which is a huge corporation, the question is, what about small and medium enterprises? And from what you've said this afternoon, that's a key focus of the Fair Employment Charter, which is very encouraging and path-breaking. Child poverty in Sefton, wow. The question I get asked regularly is, yeah, but as I'll show you before I finish, child poverty nationally is going up. Things are getting worse. What can we do locally? And what you've shown us from Sefton is there's a great deal that can be done locally. Marmot leads, the fact that there are leads for each of the 9 local authorities working on each of the 8 domains. My colleague Tammy Boyce has been intimately involved in what's been happening. And the fact that you meet regularly, share best practice, ask questions, is exactly what's needed. The learning that will come out of Cheshire and Merseyside, I venture to suggest, will be important for Cheshire and Merseyside, but will have wider impact. Others will learn from your experience. Given how much local knowledge there is, I'd like to put what's happening in Cheshire and Merseyside in a broader context. UK food price inflation at the 3rd highest level since 2008. What we now see is that food price inflation in the UK is higher than in other European countries. I've heard philosophical discussions about whether it's due to Brexit or the fact that we just messed up our economy. But the fact is, food price inflation is at staggeringly high levels and higher than it needs to be. With the good news, inflation rates are coming down. That doesn't mean prices are coming down. Prices are still going up. Just the rate of increase may be slowing. So that's not good news, particularly when public sector wage settlements are much lower than the rate of inflation. So if food price inflation is slowing, prices are still going up. It's still unaffordable. And the UK has to act over poverty, housing, and equal rights, says the United Nations. English get the budget cuts that are threatening levelling up. I had a figure from IPPR North that the 2021 levelling up budget amounted to something like £30 per person per year. The cuts to local authority spending over the decade from 2010 were in excess of £400 per person per year. We'll take £400 away, we'll give you £30 back, and you can level up. Don't think it quite works. If we look at the value of selected benefits as a share of average weekly earnings, the basic state pension was coming down as a share of weekly earnings. As you know well, the triple lock kicked in with the government that was elected in 2010. So there was not further deterioration of people reliant on the state pension. Unemployment benefits has had a long-term decline, and there was some interruption here, but the long-term decline has continued. When we look at the proportion of equivalized non-housing household income spent on essentials, food, fuel, clothing, and transport, 2006, 2012, 2019, for people in the richest quintile, yes, the proportion of their income spent on essentials did go up a little bit. But look at people in the poorest quintile. It went up dramatically by 2019, before the cost of living crisis kicked in. There's just no flexibility, no resilience in the system here. If you're in the poorest 20% and prices go up and you're already spending nearly 60% of your income on these essentials, you can no longer afford the essentials. Proportion of all adults making energy efficiency improvements. So for the most deprived and the least deprived, yep, but not surprisingly, the less deprived you were, the more likely you were to be making energy efficiency improvements so that you're not hit as badly by the price of energy. But spending less on food shopping and essentials, it goes the other way. So the rich are better able to protect themselves. The poor are hit hard by the cost of living crisis. And these figures from the Food Foundation, which have been monitoring food insecurity, had smaller meals, skipped meals, been hungry but not eaten for a whole day. Food insecurity now affects 22% of households with children. More than 1 in 5 households with children is hit by food insecurity. Percentage of households reporting buying less of each food type, food insecure, food secure, less fruit, less vegetables, less fish, but more of junk food. When people who understand nothing say, how can poor people have trouble with affording food when there's more childhood obesity among poor households? Yes, of course, because junk food is cheaper. Energy-dense food is cheaper. If children have to eat something and all you can afford is food rich in sugar, fat, salt, that's what you feed your children. And all the social determinants of health apply more to people who are disabled. Overall spending, the percent who've tried to cut back spending overall disabled, non-disabled, energy use. So if you're disabled, you're trying to cut back on energy use, sitting in your house, shivering, clothing and shoes and the like. Citizens' advice is a growth industry. This is the proportion of people who've gone to citizens' advice bureaus for the first time, going up dramatically. And citizens' advice by month of the year in 2019, 2020, 2021, and 2022, and 2023, the beginning of the year, the problems are getting worse. And look at this. If you're in the richest, if you're in the richest 10% of households in France, you pay about 6% of your income on home energy. And if you're in the richest 10% in the UK, you spend, like in France, about 6% of your income on energy. If you're in the poorest 10% in France, you pay about 10% on your energy. If you're in the poorest 10% in the UK, you pay nearly 18%. That gap between the richest and the poorest in the percent of income spent on energy, that gap is the biggest in Europe. The UK is a terrible place to be poor. And things aren't getting better. If you unhinge the brain by listening to Prime Minister's questions, you would listen to a succession of Prime Ministers telling you how brilliant Britain is doing. If instead you look at the numbers, and we're the only G7 economy that hasn't recovered to pre-pandemic levels of GDP, and our growth prospects are the worst of the G7. This is from the Financial Times. If you look at the growth of GDP per person from 1990 to 2007, and then look at what happened when we fell off that trend after the global financial crisis. So Germany fell off that trend and got a fall. And in fact, by 2021, Germany were about 6% below where they would have been had they continued on that 1990 to 2007 trend. Japan's about 12% below, France 18%, the US, Italy, and the UK nearly a third below. I've heard George Osborne, the Chancellor, on successive interviews say, oh, we did brilliantly after 2010. We were the envy of all the rich countries. Really? Germany, Japan, France wanted to be where we were? Really? And then it only went bad in 2016, he said, after the Brexit referendum. Really? You can see the break in the curve? It's just been downhill from 2010 on. We are a poor country with some rich people. That's the headwinds. I said a few moments ago, Britain is not a good place to be poor. So they're the headwinds that Altogether Fairer in Cheshire and Merseyside is addressing, and addressing in an encouraging way. If you're unemployed in Denmark, you get 90% of your previous earnings. In Sweden, you get 80% of your previous earnings. Italy, Netherlands, Spain, Germany. If you're unemployed in the UK and you get universal credit, That's 14% of average UK earnings. That's not very impressive. And of course, the pandemic's been pretty good for some. Food and energy billionaires, $453 billion richer than 2 years ago, finds Oxfam. Not good, is it? But this is the good news. Coventry, 2010, declared itself a Marmot city. We worked before we were working with you, with Greater Manchester, Build Back Fairer in Greater Manchester, Altogether Fairer in Cheshire and Merseyside, Lancashire and Cumbria, Luton, a Marmot town, Waltham Forest, a Marmot borough. We've got a report we're about to publish, Gwent, Southwest region. More than 40 local authorities have been working on implementing Marmot recommendations one way or another. Over the next 12 to 24 months, we will, I hope, get from Cheshire and Merseyside news on the 22 Marmot beacon indicators, so we'll know, and the world will know, how well you're doing. What we all hope is there'll be good news, and good news that can be shared, which is of vital importance. So it's these 8 principles with which you began, thank you, Ian, with which you began the afternoon, that we'll be looking for. Labour. I try not to be tribal politically. And I've said I'm willing to work with any government. It was put to me recently by a former government minister in the Conservative government. He said, you know, the present government doesn't like you. Well, I kind of knew that, but to hear it put quite so boldly was something. Well, Labour published its health mission on Monday. Squirreled away on page 12 of the technical document was this: the next Labour government will amplify the approach of Marmot cities like Greater Manchester and Coventry by making England a Marmot country, tackling the social inequalities that influence health. Children have the best start possible, smoke-free Britain, and empower people to take responsibility for their own health. Wow. We need to hold them to that, don't you think? I think you've got legitimate grounds for complaint that they didn't include Cheshire and Merseyside in their statement, but let's hold them to it. Let's say we want a country that will empower people to take responsibilities for their own health, and that means action on the social determinants of health. As I said, I'm excited by the initiatives on the Fair Employment Charter that I think you're involving small and medium enterprises. We did this report with Legal and General, the business of health equity, the Marmot Review for Industry, and we said 3 domains of recommendations. Paying conditions. Everyone should have a real living wage. Good conditions of work. Goods and services. If you're the tobacco industry, forget it, we can't work with you. If you're promoting junk food, we can't really work with you unless you want to promote healthy food and make it affordable. And wider impact on the community and the environment. Anchor institutions. In fact, East London Foundation Trust, which declared itself a Marmot Trust, one of the public health doctors looked at our framework for industry and said, hey, we could do that in East London Foundation Trust. Proportionate universalism, universal, targeted. So East London Foundation Trust as a training and employment provider, orientation to service users, and looking at the wider community, taking the approach of proportionate universalism. Really exciting. Legal in General has had an initiative with the hidden workers, and I went to a meeting at L&G a couple of weeks ago where they were discussing this. So hidden workers, for example, most organizations, big organizations, have outsourced cleaning services. Those companies that provide cleaning services employ people in really substandard conditions. They don't pay a living wage. There's no security of employment. You work ghastly hours. It's really ghastly. One leader of one of these corporations that provides cleaning services said proudly, he gives a guaranteed employment, a real living wage to all the people who work for his company. When he bids for contracts, he explains why he's more expensive. And he's running a successful business. He gets the work. And I put it to a couple of other employers in this sector, said, what would you need to do that? And they said regulation would be helpful. So this is not business fighting against regulation. Regulate it so we don't get undercut by unscrupulous employers, and then we will pay all our employees a real living wage. Alan Higgins, who inspired us all a few moments ago, half an hour ago, is convening our health equity network. We have more than 800 people registered in the health equity network. And the aim of this health equity network is what I said a moment ago about Cheshire and Merseyside. We hope that you'll have brilliant results from the inspiring initiatives that you've been sharing this afternoon, and that you can share them with other regions all around Britain and potentially globally. You'll also be able to say what didn't work, what does and what doesn't work, and to what extent, and what the lessons are. So we very much want to make this real, and Cheshire and Merseyside is a key partner in it. By the way, let me mention something else, which was really exciting. WHO Euro has discovered, quote unquote, the well-being economy. There are 6 countries that are signed up to the well-being economy, but there's a number of communities, cities that are also signed up. And the Liverpool City Region Combined Authority signed up in 2020. The pandemic supervened and made everything more difficult. But the whole idea, and that's really what this is about, that we want to save the planet, we want to deal with racism and discrimination, and we want to create fairer societies with better health for all, is key to the Wellbeing Alliance, and it's key to Altogether Fairer in Cheshire and Merseyside. I chaired the WHO Commission, which reported in 2008, the WHO Commission on Social Determinants of Health. WHO is working on a world report on social determinants of health. We're expecting it this year. I hope it'll be this year, but I've seen a fairly late draft and it's being worked on. But that's another attempt to put it back on the global agenda where social determinants of health belongs. Colleagues, you're not doing this to excite me, but what you're doing is really exciting. I'm absolutely inspired by what I've heard and the commitment in Cheshire and Merseyside. We're going to change the world, and we're going to start it in Cheshire and Merseyside. Thank you.
So Michael, thank you so much. We are all excited as well, you'll be pleased to know. So it's not just you that's excited, and that was an inspiring speech. So thank you so much. We are now going to have a short Q&A session. So we've had some questions that have been coming in the chat. And what if all our panelists could put their cameras on so we can see you all. No, there's no hiding today, I'm afraid. So if you can all put your cameras on, and if you feel like you'd like to answer the question, put your hand up. But I'll probably ask Sir Michael first. About, and in your wide experience, have you got any examples of GP-led initiatives that have been making a real difference working in deprived communities?
Well, what we're always looking for is the evidence. What I know in Edinburgh, the Deep End practices, a group of GPs, they call themselves the Deep End practices, have got together and are doing exactly what you asked. Now, what the evidence is on how much they've managed to reverse health inequalities, I'm not aware. But I know that they're committed and they're doing it, and it's led from the GPs. We know in East London, the famously Bromley by Bow Community Centre and Primary Care has been very much engaged on social determinants of health. And again, we've talked to them about the nature of the evidence they have. And they say, well, when it wasn't really a research activity, we're doing it. So I'm aware of examples of GP-led initiatives. I'm less aware of the evidence of what they've done.
Okay, that's really interesting, and maybe that's something we can do in Cheshire and Merseyside as part of our network. Start collating that sort of information. Ian, did you want to come in on that as well?
Yeah, if you wouldn't mind. I suppose it's I wouldn't say it's at its infancy, but we have some really committed GPs who are already speaking. So at the Integrated Care Boards, working with Dr. Jonathan Griffiths and Greg Irving, I mentioned at the beginning of my presentation, along with their GP colleagues, something about wider primary care. We're on that journey already, thinking, because Cheshire and Merseyside is so big, each area has its own levels of deprivation as well. So they're just trying to work through that. And I think in our year 2 realities, we want to do more of that sort of work and work with our primary care leaders within that space. So taking the learning from the Deep End initiatives that Sir Michael referenced as well.
Thank you. That was really helpful, and the more we can share that for other GPs to be inspired, the better, really. So the next question is, partnering with community organisations is key to achieve system change. How do those community organisations engage with and understand the complex system around boards, partnerships, etc.? So how do we make sure that we're really engaging with that wide range of community organisations? I'm not sure who'd like to answer that one. Ian?
So there's a few ways to do that. And I suppose people on this call and could ourselves have to take responsibility for that. But we have a very vibrant community sector, volunteering community sector. Normally in each one of our places, we have a lead around that. They should have on our health and wellbeing boards membership. They'll be linked into what is the new sort of NHS sort of place committees, and there is leadership sitting on the new integrated care boards and our health and care partnerships. So through your local community sector leads, they should be able to navigate or at least be in touch with their local authority, cabinet portfolio holders, elected members, gatekeepers into the work there to be able to navigate that system as well. And if anyone is struggling through that, I'm sure that we can point them in the right direction.
Thank you. I noticed a question about how we involve residents with this, and so that it's not just a top-down approach, that it's a bottom-up approach. And I'll actually ask Sir Michael first if he's got some good examples from other areas about how residents are involved in their work, and then perhaps the rest of the panel could give some examples from their areas and what more could be done as well.
Well, I'm sure more could be done, no question. But in the work we did in Greater Manchester, it was, as you know, there are 10 local authorities in GM. Manchester City particularly got active, and part of their planning after we did our report was to set up groups, community representing the community, which fed into they had a Marmot implementation group, but they very much, I think, genuinely were committed to the people voice being heard, and that fed into it. I really like what came out of the Manchester City work, their own plans building on our report, and I'd like to think that involving the population was an important part of developing those plans.
Thank you. That was really important points there. Thanks, Sir Michael. Raj.
So we set ourselves out to engage with the public and residents to make sure we have a really good engagement with them. Do we achieve that? Well, I can't honestly say yes. I can't give you a calibration of that. We're not effective at measuring it. And we're thinking about how we do that in the ICB. But the real reason I put my hand up was this, which was suggest that all of us as individuals wishing to support and change the system adopt a bit of the reverse mentoring approach to understanding what people lived experience are. So I do some reverse mentoring, but generally I do it on the basis of people who've got disability or from an ethnic minority to support them in their careers. But I wonder whether what we should do is think about how we, as leaders, officers in the system, actually engage with the public on a more one-to-one basis, so we can hear directly from people that we can establish a relationship with, not people associated with our organisations, but not people employed by our organisations, people who perhaps potentially use our services, and just stay with them for a couple of years to understand what their journeys are. It has a really powerful impact on your viewpoints and your mindsets.
Thanks, Raj. No, that's a good idea, and one we need to have a think about and perhaps take forward. Sir Michael.
Yeah, I wanted to add something. Bobby Duffy from King's College, who does policy surveys and the like, he told me that if you do a survey of the general public about health, they think in general what you get back is health is a matter of personal responsibility and getting to see your doctor when you're sick, and it's a problem because of lead time of getting to see your doctor. In other words, if that is what the population thinks about health, we're not doing terribly well in engaging, because my own hypothesis is if you talk to people about what the problems are in their lives, what they describe is problems with preschool, with education, with community, with housing, with cost of living, with work. In other words, what they're telling you is the social determinants of health are the real problems in their lives. They just think health's this other thing. It's not smoking or getting to see the GP. So I think community engagement is absolutely vital. It's actually people recognizing that the things that they think are important in their lives, the ones I've just catalogued and that we all know about, those are the social determinants of health. That's what needs to be addressed to improve health and get greater health equity.
Well said, and absolutely. I know my residents, they talk about access to buses and how good the local school is, community centres and all of those sort of things. So yes, absolutely. Oh, Margaret.
Oh, I was just going to add that I think we are very conscious that it's not always easy to reach everybody. And we know about digital exclusion, and we've been doing some work recently where we've had staff who've actually gone out to our main shopping centres to just talk to people. And it's just trying to get as many different sources of information as possible, that it's not always done through the usual routes. We need to always look beyond that. And I've just noticed that there's something's gone in the chat from OHID colleagues about the place standard, and I know that's something that we've been looking at in Sefton as to whether we could use that to help us with our engagement. So it's something for a lot of us to have a look at.
Thank you, Margaret. Any of the other panelists want to contribute towards this particular question? No? Okay. Now I've got a question for the regeneration directors for Altogether Inspired, asking, is housing covered within regeneration directors for Altogether Inspired? So is housing included within this? So I don't know who would like to answer that. Ian?
I might not answer it in its entirety, but working with all our housing providers, there is a informal network growing. It's been particularly more for our registered social landlords, housing associations. We know what a major role that good quality housing can have on people's health and access to that. So it is in there. It's one of the key social determinants of health. We've you might at the beginning of our presentation today, you heard about the fuel poverty and challenges around good quality housing that we've been working with. Doesn't mean we're obviously solving that at all, but it's about highlighting those risks and working with our partners on that. So again, it's a really good question, really, for us to take forward in its infancy.
Because I think the example we had from Sefton in your regeneration project, there was housing was part of that regeneration, wasn't it? Having that mix of lots of different things in that area. So what was it that sort of helped you to make that decision about the mix that you had within that regeneration project?
I'm probably not the best person to answer on behalf of the whole project. It's led by our place director, our executive director. But I think what was really key was to have just a multi-purpose area. So the Strand is it's the hub of the community in Bootle, and it's, you know, most people that use that shopping centre live 10 minutes away from the shopping centre. And what's been really clear about the approach in Sefton is that we want to develop something that still remains at the heart of that community and is going to be used by local people. So that brings in things like housing. You know, it has to retain a retail offer, but it has to be a space that can be used by everybody. So that it's the practicalities. It's you know, there's economic practicalities as well about how do we repurpose buildings that are no longer going to be used for office space. For those of you that don't know, we've got a really large high-rise office space. It used to be I think the tax office used to be based there many years ago, and but it's the whole office quarter of that area has just reduced dramatically long before COVID, but obviously COVID's accelerated that. So we have to look at different ways to keep that area, you know, vibrant and relevant to the people that live there.
Absolutely. And someone's actually put a comment about this seems to follow the 15-minute city model, which I know there's a lot of controversy about, but actually it's having everything on the person's doorstep, really, and that whole model that you've done there seems to be part of that. Anna, did you want to come in?
Yeah, I was just going to add to that really in terms of the Strand development and the focus on it not just being somewhere where there's a shop, but somewhere where it's a nice place to go. It's a nice place to feel more relaxed. It's a nice feel to connect with, you know, some element of nature. There's a local canal there, and it's just a nice place to promote a sense of well-being as well. So an extension really from good housing. It's good surroundings, and I think that is the emphasis of what we're trying to develop as well.
Excellent, and it would be really interesting to see how that, when it's finished, the knock-on effects that it's having on our communities in Sefton. That's really interesting. So we've had an offer here from the Health and Justice Lead for the Probation Service rep in Merseyside, Heidi Price, who has been working closely around the core 20+5, which is the health inequalities work of the NHS, who is keen to link in to the work that we're doing here. So that's a good networking opportunity that's come about. So I don't know who wants to pick up Heidi's offer there so that we can link into the work they're doing. Have we got a volunteer? Alan, Alan put his hand up.
I can in just before Ian. I would like to volunteer on two counts. One, yes, Heidi, we would love to have you engaged in that Altogether Inspired initiative that I was talking about earlier. So let's follow up as to how we do that. It's in its infancy, so you can get in at the start and help us design it. With another hat on, Sir Michael referred to the Health Equity Network that we have set up that is a national initiative. And we were only this week, in fact, it was yesterday, talking to a health equity, health justice partnership lead about how there was lack of connection for health justice partnership leads across the country. So we will be setting up a subgroup within that national network to enable those people to talk to each other and help to inspire and connect with each other. So you'll be able to join that network in Cheshire Mersey, but also the national network, and make those connections. And I'm happy to talk to you about that following this meeting.
That's excellent. And I've also picked up in the chat the question around how we inspire and engage with our communities. Cheshire West Voluntary Action are currently co-producing a local voices framework, which will be a set of principles which all projects in Cheshire West will be encouraged to adopt. And so when that's completed, that project, we'd be happy to share that across the network, because that co-production and involving people is so important. Rob, did you want to come in? I think, and then I'll give the last word to Sir Michael.
Well, no pressure there then. I think there's, just to pick up the point around probation and justice support, and it picks up the point that Raj was making previously, that too often we tend to organise around kind of services that we deliver to people, and we don't take a step back and ask what people need in all of that, and where can we draw down services from them. I'm mindful that it's 20 years this year since Every Child Matters Change for Children was published, and that idea around organising services around children and their families. I think we've seen some progress on that. I think we've still got some way to go, though, in terms of organising services around adults as well, in terms of making sure that everything fits around them. And probation, offenders is a really classic case in point of where the system isn't quite working as well as it could do, should do, or needs to.
Thank you, Rob. And Michael, finally, a question for you from me. If we all meet up again in a year's time to reflect on the last year, what would you like to have seen us achieve over the next 12 months? What is it you'd like to see us doing?
I'd like to see action or evidence of action at two different levels. One level is the beacon indicators. I'd like to see movement in those beacon indicators, the 22 measures that say, yep, there's already signs of improvement, that children eligible for free school meals are doing better on their end of reception year assessment. You can get movement in such a thing quite quickly. And so to look at the indicators and see that there's actual movement. The other level is I'd like to see the level of enthusiasm and commitment that's on show this afternoon, if possible, even more so, that people continue to be enthusiastic and committed because everybody can sense that progress is being made. More people are coming in. I mean, take the one that just, there's health justice partnerships. Take crime. We know the majority of young people in prison have a mental illness. In fact, have 2 or more diagnosed mental illnesses. People without mental illness don't get banged up in prison. Well, there's exceptions. Trump has clear evidence of mental illness, and he's very unlikely to go to prison. But people who get put in prison have, on the whole, have 2 or more diagnosed mental illnesses. So we need to make common cause with the criminal justice system and the police, investing. I'd like to think that if Sefton is successful, you'll have fewer young people banged up in prison. There'll fewer young people involved in the criminal justice system because Sefton, by taking action on child poverty, has done something about early child development, which will reduce the incidence of mental illness. So, in other words, I'd like to see both things, movement on the indicators and this level of enthusiasm and commitment across the different sectors, even more so.
Thank you very much, and we'll take all of those on board and make sure they happen, that we're a doing place here in Cheshire Merseyside. So thank you so much. And could I have a big round of applause for all of our panel, Sir Michael and all of the panel, for their input today. It's been very much appreciated. So I'm afraid that's all we've got for today, but I'm going to ask Ian Ashworth for some closing remarks to sum up what we've heard this afternoon and some key points to take away.
Thank you, and thank you for everyone staying with us. And I have to say, it's been hard at times to keep up with the chat, but just shows how passionate everybody is and contributions being made in there. Some of the things I think for me to take away is we've got to keep the profile up and going. It's the only way we can get to do this is by working together and use the energy and the challenge you put in that chat and connect you into local teams to do that, really. And we need to get a bit better as well as sharing the innovation and the challenges being seen, working directly with our communities and those principles from that. We do need to advocate for greater resources locally, upstream and prevention. That's something that we really need to advocate strongly together. And that health in all policies approach, I think we had today the importance around the economic drivers and also housing as well for us to really start making a difference. So just really, really grateful to everyone's energy, passion, and let's keep that going, really. So I think we're naturally going to draw us to a close now, aren't we? So you'll be able to find all this, be able to watch this back on the Public Health Collaborative Champs website with all the slides and everything on there. Please encourage you to share that with far and wide. The more people we can get talking about the inequality agenda, the Altogether Fair agenda, the better it is to keep that momentum going. So thank you, everybody, and have a good afternoon.
Thanks, Ian. And just before you all log off, you can't get away with doing nothing, everybody who's been sitting in here. So we're going to have another Mentimeter. And the question is, what one action will you be taking today to help meet our goals? So we'd like every single person in our virtual room today to think about an action that they're going to take away to help meet our goals of an altogether fairer Cheshire Merseyside. So it's the www.menti.com, and there's the code that you put in. It will be up for a while. And I know at the end of the launch event, we had a wonderful word cloud that described how people were feeling. So today is about action and what you're all going to do as individuals and with your organisations as a result of what you've heard. There will be a digital goodie bag as well coming out to you, and that will be show the recording of the event and more information about what you've heard today and some other vital resources. So remember, go on to menti.com, use that code, and everyone's actions will start showing on the screen. So thank you all very much for attending today, and thank you to all our wonderful panelists, and have a good afternoon. Bye bye.